So on Monday, February the 5th, we get to know from the statement from Buckingham Palace that actually Charles III has cancer, and it landed on all the news pages around the world, not only in Great Britain, but also in US and in multiple European nations. Many world leaders wished all the best to King Charles, Joe Biden, but also Canadian Prime Minister or Australian Prime Minister. There were a lot of well-wishers. And today I'll just sum up what has happened. So Buckingham Palace stated that King Charles has a form of cancer. The type of cancer has not been disclosed. We only know that it's not a prostate cancer, but it was detected during a recent treatment for an enlarged prostate. The issue of Charles's health appeared in the public space already in mid-January. 17th of January, the world was informed about Charles being directed to the hospital for a corrective surgery for an enlarged prostate. And already then it was emphasized that this announcement was also made to lift the taboo on the subject, to embrace men around the world to check up, and that it's basically not a shame to go to the doctor. So it was a very clear message from Charles that he wants to raise the taboo from the topic. And you must know that statements concerning royal health are not something that we used to, because in the times of Elizabeth II, we knew almost nothing. When we knew maybe only if it was super visible, like a broken leg or a broken arm or a cold, but we had really, really limited information. We never found out what Queen Elizabeth II was suffering from. And even over the weekend, we could see the king in Sandringham, waving to the crowd, coming back from church, and on Monday, the next day, he flew to London and started his treatment. Although King will suspend his public appearances, he will still fulfill his role in Clarence House with paperwork, receiving all the important documents, receiving Prime Minister Rishi Sunak, and taking part in all very important meetings. But he will not appear in public until the end of his treatment. The 75-year-old king is entirely positive about his treatment and cannot wait to return to full public duties as soon as possible. There are no further details on the stage of the cancer or prognosis for it. We only know from actually the Prime Minister Rishi Sunak that it was detected at an early stage. It is assumed that King Charles has informed his closest family personally, of course his wife Camilla, but also his siblings and 2 sons. Prince William, who will take a lot of responsibilities from his father and will probably appear more publicly, and Prince Harry. Of course, Prince Harry lives in the USA, and he's there with his wife Meghan and 2 kids. But after the news that his dad is sick, he decided to come and visit King Charles. So we expect his visit very soon. I bet you ask yourself, what if the king is unable to perform his duty? Is there anyone to replace him, help him with his duties? And there is a procedure for this. It's called Councillors of State. Basically, it's a group of people from the royal family that can step in and replace the monarch, or kind of act as the monarch and take some responsibilities while he is unable to perform his duties. And in this group, there is Queen Camilla, Prince William, Princess Anne, and Prince Edward. So if it happens that the king is unable to perform duties as a monarch, one of those people will step in. Definitely we'll see more of Prince William than in the recent weeks. We haven't seen him so much because his wife Kate actually underwent procedure herself. 17th of January, apart from the news that the king will go to the hospital for the correction of enlarged prostate, also the news broke that Kate has undergone medical procedure in abdominal area. Apparently it was a planned procedure, but the treatment afterwards and, you know, bringing her back to normal speed will take more than 2 months, and Kate will not see Kate up until at least after Easter. So it takes around 2.5 months for her to come back to full health. And because of this, William was a bit less seen publicly. He took care of Kate, he took care of the kids, but now because of his father's illness and treatment, he will have to come back to the public duties. And it has already been announced that Prince William will be back to work in public this week. I would like to underline once more why King Charles has decided to go public with his illness. And firstly, with the enlarged prostate, and then with the cancer. And as I said, it's never happened before in the royal family. That openness is something very fresh to the British royal family, but it may bring a lot of good. British royal family members are influencers, not in a modern way, but they have a huge influence, not only over people in Britain or their realms, but worldwide. They're one of the most famous, most recognizable people in the world. Every single information site around the world, news site, has published information that King Charles III has cancer, right? And if Kate buys something new, a lot of girls, they want to have the same. So she has an influence on a lot of people. And because they decided to go public with the issues, they may influence someone to go to a checkup and save their lives. And this is an incredibly moving move from their side, but also it's extremely important to raise the awareness of enlarged prostate, to raise the awareness of cancer, to raise the awareness of regular checkups. King has also been a patron and has been really much involved in the organizations that are involved in work for cancer patients. So it's also very important for him to raise the taboo on of those issues. I'm very glad he did so, and I hope he will be back to public duties very soon. Get better, sir, and get better also Princess Catherine. I hope you are great as well, and I wish you all the best for the coming weeks. Thank you so much, and see you next time.